What if I told you that something you threw in the trash this morning could actually be part of a simple nightly routine that may help your teeth look cleaner and brighter after just 7 days? And what if I told you that most people over 50 are making at least 2 or 3 mistakes every single night that are silently working against the appearance of their smile, without them even knowing it? Stay with me, because in the next few minutes I'm going to walk you through something practical, something affordable, and something that you can start tonight. My name is Dr. Carter, and let's talk about your teeth. I've been practicing general and preventive dentistry for over 2 decades, and I want you to know something before we go any further. I don't believe in miracle cures. I don't believe in overnight magic, and I am not here to sell you anything. What I am here to do is share with you something that many of my patients have asked me about over the years. This idea of using a banana peel on your teeth before going to sleep, and give you a real, honest, medically responsible answer about what it is, how it works, what it may realistically do, and just as importantly, what it cannot do. Because I think you deserve the truth, not a sales pitch. So let me start from the very beginning, and let me explain this clearly. Your teeth go through a lot every single day. If you're like most of the patients I see in my practice, you drink your morning coffee or your tea, maybe black, maybe with milk, and you go about your day. You eat your meals, maybe a nice pasta with a dark tomato sauce, maybe a glass of red wine in the evening. You brush your teeth before bed, hopefully, and you wake up and do it all again. And over time, over months and years of this routine, the surface of your teeth picks up what we call extrinsic staining. These are surface stains. They sit on the outer layer of the tooth, the enamel, and they come from pigmented compounds in the foods and drinks we consume every day. Now here's what I want you to understand. These surface stains are not the same thing as intrinsic discoloration. Intrinsic discoloration happens inside the tooth. It's in the dentin, the deeper layer. And it can come from things like certain antibiotics taken in childhood, trauma to a tooth, fluorosis, or simply the natural aging process where the dentin gradually darkens and the enamel thins. No home remedy, not banana peel, not baking soda, not oil pulling, not strawberries, nothing you do at home is going to change intrinsic discoloration. That requires professional treatment, and I'll be very clear about that throughout our time together today. But surface stains? Those dull, slightly yellowish, slightly gray deposits that sit right on the surface of your enamel and make your teeth look less bright than they used to? Those are a different matter, and that is where a ripe banana peel, used correctly and consistently over 7 nights, may make a gentle but noticeable difference. Let me tell you why. When most people hear banana peel, they think of a cartoon character slipping on the floor. They don't think of dental care. But here's what's interesting. The inside of a ripe banana peel, and I want to emphasize the word ripe because this matters enormously, contains a combination of naturally occurring compounds that have caught the attention of people interested in natural home care for years. These include potassium, magnesium, and manganese, all of which are minerals that your tooth enamel actually interacts with. There's also a gentle natural abrasive quality to the inner surface of the peel, very mild, very gentle, and when you rub it carefully across the surface of your teeth, what you're doing is delivering a small amount of these minerals directly to the enamel surface while very gently disrupting the thin biofilm and surface deposits that accumulate during the day. Now, is this the same as professional whitening? Absolutely not. Professional dental bleaching uses active peroxide compounds that penetrate the enamel and chemically alter the color of pigment molecules inside the tooth. That's a clinical procedure with real measurable results and, when done properly, a solid safety profile. A banana peel is not doing that. I want to be completely honest with you about this because I think honesty is the foundation of good health care. What a banana peel may do, and I say may deliberately, is help reduce the surface dullness that accumulates over time. It may make your teeth look somewhat cleaner. It may support a brighter appearance after consistent use over several nights. Some people notice a difference. Some people notice a very subtle difference. And some people notice almost nothing, particularly if their discoloration is intrinsic rather than surface-based. These are the realistic expectations I give my patients, and I'm giving them to you now. So let's talk about the protocol. The actual step-by-step process that I want you to follow if you decide to try this for 7 nights. First, and this is crucial, you need a ripe banana, not a green one, not an overripe, very brown, mushy one either, although slightly spotted is fine. You want a yellow banana, ideally with a few small brown spots just starting to appear. Here's why the ripeness matters so much. A green banana contains significantly higher levels of astringent compounds, particularly tannins, that can actually have a drying, almost harsh effect on the soft tissues in your mouth and on the enamel surface. The mineral content in a green peel is also distributed differently. It hasn't developed the way it has in a ripe peel. I tell my patients to think of it this way. A green banana is still in the process of becoming what it's supposed to be. You want the finished product. You want ripe. Second, you need to do this at the right time. The ideal moment to apply the banana peel is after you have already brushed your teeth at night. This is important. You brush first, you clean your teeth properly the way you always do, and then you perform this protocol. Do not skip your regular brushing and replace it with this. That would be a mistake, and I'll talk more about common mistakes in a moment. So, you've brushed your teeth. Your mouth is clean. Now take your banana peel, cut off a small section, roughly 2 to 3 inches is plenty, and you're going to use the inside of the peel. The soft, slightly waxy, slightly moist inner surface. Hold it between your fingers and press it gently against the front surface of your upper teeth. Now I want you to rub gently, slowly, in small, circular motions, not hard, not back and forth like you're scrubbing a stain off a countertop. Gently, the way you would rub lotion into sensitive skin. The reason for this is that enamel, while it is the hardest substance in the human body, can still be worn down over time with excessive abrasive contact. We're not trying to scrub anything off. We're trying to deliver these naturally occurring compounds to the tooth surface and allow them a moment of contact. Gentle is the word I keep coming back to because I mean it. Spend about 2 minutes doing this across your upper front teeth, the ones that are visible when you smile. Then do the same for your lower front teeth. 2 minutes each is sufficient. You don't need to spend 20 minutes on this. You don't need to cover your back molars obsessively. Focus on the visible smile zone. Those are the teeth people see. Those are the teeth where surface staining is most noticeable to you when you look in the mirror. After you've finished rubbing, you'll notice there's a light residue left on your teeth, a thin coating from the inside of the peel. I want you to leave that there. Don't rinse, don't brush again, don't drink anything. Just go to bed. The idea is to allow that residue to sit in contact with the tooth surface overnight, giving those minerals the longest possible window of exposure to the enamel. In the morning, your normal routine continues exactly as always. You wake up, you brush your teeth with your regular fluoride toothpaste, you rinse, and you go about your day. That's it. Now let's talk about the mistakes, because in my clinical experience, this is where most people go wrong, and it's the reason they either don't see any results or in some cases end up causing themselves minor irritation that could have been completely avoided. Mistake number 1 is using a green banana. I've already explained why, but I want to emphasize it again because I see this come up constantly. People buy a banana at the store, it's not fully ripe yet, and they think, well, it's still a banana, it should work the same. It doesn't. The ripeness is not a minor detail. It is the most important variable in this entire protocol. Wait for your banana to ripen. Put it on the counter and check it tomorrow. Mistake number 2 is rubbing too hard. This is a very common one, especially for people who are motivated and enthusiastic and really want to see results. I understand that impulse completely, but harder is not better here. Aggressive rubbing with any material on your teeth, even something as gentle as a banana peel, can over time contribute to enamel wear, and once enamel is worn down, it does not regenerate, it does not grow back. So please, be gentle. If you are rubbing hard enough that your teeth feel sensitive or sore afterward, you are rubbing too hard. Mistake number 3 is rinsing immediately after the application. I just mentioned this in the protocol, but it deserves its own discussion because it's such a common reflex. We are conditioned to rinse after anything goes in our mouth. But if you rinse right after applying the banana peel residue, you wash away the very compounds you were trying to deliver to your enamel. Leave the residue on overnight. It is not harmful to have it sit on your teeth while you sleep. Your saliva will continue to work naturally through the night, and in the morning, you brush as normal. Mistake number 4 is expecting results in 1 or 2 nights. I have patients who try something for 2 days and conclude it doesn't work. The human body doesn't move that quickly, and neither do surface stains. Surface stains accumulate gradually over months and years, and reducing their appearance is also a gradual process. 7 nights of consistent application gives your teeth enough time to show a potential change. Going in with realistic expectations also means you won't be disappointed and abandon a routine that might actually have been working for you. Mistake number 5, and this is a big one, is continuing to eat and drink heavily staining foods right before bed during this protocol, and I'll talk about this in detail when we discuss diet and habits. But briefly, if you apply the banana peel at night and then have a cup of black tea or coffee or a glass of red wine in the 20 to 30 minutes before you close your eyes, you are actively restaining your teeth right over the residue you just applied. Timing matters. Try to have your last cup of anything pigmented at least an hour or 2 before you begin your nightly dental routine. Mistake number 6 is using this protocol while you have unresolved dental problems. I cannot stress this enough. If you have bleeding gums, and I mean when you brush or when you look at your gums they look red, swollen, or they bleed, that is a sign of inflammation or gum disease, and it needs professional attention. If you have a tooth that is painful, a known cavity, sensitivity that comes and goes, a loose tooth, any swelling in your jaw or gum, or if you have braces, dental appliances, crowns, or recent dental work, please speak to your dentist before beginning any kind of home care protocol. This is not me being overly cautious. This is me being protective of you. Let me take a moment now to talk about the science a little more, because I think when people understand why something may work, they are more thoughtful about how they use it. Tooth enamel is a crystalline structure. It's made primarily of hydroxyapatite, which is a calcium phosphate mineral. Over time, pigmented molecules from food and drink, the chromogens in coffee and tea, the tannins in red wine, the compounds in dark sauces and berries, these molecules are attracted to the enamel surface and to the thin protein film that coats your teeth, called the pellicle. They bond to it. And gradually, layer by invisible layer, this is what creates surface staining. The tooth doesn't change color on its own in most cases. The surface accumulates a film of colored deposits that makes it appear darker or more yellow. Potassium, magnesium, and manganese, which are present in the inner flesh of a ripe banana peel, are minerals that interact with tooth enamel in ways that researchers have explored, particularly in the context of remineralization and surface interaction. The gentle rubbing action also provides very mild mechanical disruption of the pellicle and surface deposits. It's not dramatic. It's not the chemical oxidation that peroxide-based whitening products provide. But it is real, gentle, and cumulative. And cumulative is the key word. 7 nights in a row, consistent application. That's the only way to give yourself a fair test. I also want to be transparent about something. The scientific literature on banana peel specifically as a dental care agent is limited. There are some studies, and I mean a small number, that have explored the mineral content of banana peel and its potential surface effects. But this is not a treatment that has gone through the rigorous clinical trial process that a professional whitening system has. What I am describing to you today is in the territory of evidence-informed home care, meaning there is a plausible mechanism. There are reported results from people who have tried it, and the risk profile when done correctly is low. But I am not telling you this is proven medical treatment. I am telling you this is a gentle, low-risk, potentially beneficial nightly routine that some people find helpful and that I find reasonable to discuss with patients who ask about it. Now let's have an honest conversation about what results are realistic and what results are not. After 7 nights of this protocol, done consistently and correctly, some people may notice that their teeth look somewhat brighter, particularly in the front smile zone. They may notice that their teeth appear slightly cleaner or less dull. They may feel like the surface of their teeth has a slightly smoother, more polished feeling. These are the kinds of results that are within the realm of what this protocol can realistically offer. What this protocol will not do is turn severely stained yellow teeth bright white in a week. It will not remove tartar, that hardened calculus that builds up at the gum line, which can only be removed by a dental hygienist with professional tools. It will not treat cavities or decay. It will not improve gum disease. It will not reverse intrinsic staining that has occurred inside the tooth structure. And it will not give you the same results as a professional whitening treatment using carbamide or hydrogen peroxide at clinical concentrations. If you look in the mirror after 7 days and your teeth are deeply, significantly discolored, a gray tone, a very pronounced brownish yellow that hasn't changed at all, please book an appointment with your dentist. That level of discoloration often has a cause that needs to be properly identified, whether it's intrinsic staining, a need for professional cleaning to remove subgingival buildup, or simply a tooth that has changed color due to a structural issue inside it. I tell my patients this all the time. Home care is a beautiful complement to professional care. It is not a replacement for it. Let's talk about food, drink, and habits. Because if you're going to invest 7 nights into this routine, it would be a shame to undermine it every day with habits that are actively restaining your teeth. Coffee is one of the biggest contributors to surface staining. And if you're over 50 and you've been drinking 2 or 3 cups a day for decades, your teeth have absorbed a significant amount of chromogens, the pigmented molecules in coffee that bond to enamel and to the pellicle film on your teeth. I'm not telling you to give up your morning coffee. That is not a conversation most of my patients are willing to have, and I completely understand. But I will say this. Drinking coffee through a straw reduces the direct contact with your front teeth significantly, and rinsing your mouth with plain water after your coffee, not brushing, just rinsing, can help clear some of that pigmentation before it has time to settle. Black tea is another major stainer, and this surprises some people because tea seems healthier and lighter than coffee. But the tannin content in black tea is actually very high, and tannins are particularly effective at bonding to enamel. Green tea and herbal teas are somewhat better, but any dark or heavily pigmented tea will contribute to staining over time. Red wine is something I ask almost every patient about. The combination of tannins, chromogens, and mild acidity in red wine creates a very effective staining cocktail. If you enjoy red wine regularly, and again, I'm not here to tell you to stop, try to rinse your mouth with water after drinking it and wait at least 30 minutes before brushing. Brushing right after consuming anything acidic, including wine, can actually increase enamel wear because the acid temporarily softens the surface and the brush acts on it more aggressively in that window. Dark sauces, soy sauce, balsamic vinegar, dark tomato-based sauces, curry, all of these contribute to staining. They're not things most people think about as tooth-staining foods, but they are, and smoking. If you smoke cigarettes, pipe tobacco, or use any form of smokeless tobacco, I need to be direct with you. The nicotine and tar compounds are among the most powerful and persistent surface staining agents that exist. They penetrate deeply into the enamel pellicle and create a yellow to brown discoloration that home remedies will struggle significantly to address. Beyond staining, tobacco use has serious and well-documented consequences for gum health, oral tissue health, and overall health. I am not going to lecture you today. You've heard this before, but I want you to know that if you're hoping to improve the appearance of your teeth with a home protocol and you're also smoking, you are fighting a very uphill battle. During your 7-night protocol, try to be more mindful of these habits, particularly in the hours before your bedtime dental routine. The closer to bedtime you consume staining foods and drinks, the more fresh staining you are laying down on the enamel surface right before you attempt the protocol. Give your teeth a fighting chance. Now let me walk you through the full 7-night plan, exactly as I would describe it to a patient sitting across from me. On the first night, you are going to set your expectation correctly. Remind yourself that this is a week-long experiment. You are not looking for miracles on night 1. Take a look at your teeth in good lighting before you begin. Not a harsh overhead light, but natural light or a well-lit bathroom mirror. And take a mental note or even a photo of what your smile looks like. Having a baseline makes it much easier to evaluate any change after 7 nights. Then, after your regular nighttime brushing, take your ripe banana peel section, press the inner surface gently against your upper front teeth, and rub in slow circular motions for 2 minutes. Move to the lower front teeth and repeat. Leave the residue on. Go to sleep. In the morning, brush normally. Night 2 through night 5, you're going to do exactly the same thing. Brush first. Apply the banana peel gently. 2 minutes per arch. Leave the residue. Sleep. Brush in the morning. The consistency is the point. This is not complicated. It is designed to be simple enough that you will actually do it every night. On night 6, if you wish, you may add a very small optional variation. Take a tiny pinch of baking soda, and I mean tiny, less than 1/4 of a teaspoon, and mix it with just enough coconut oil to form a very thin paste, the consistency of loose yogurt. After your regular brushing, apply a very small amount of this paste to your teeth with a fingertip, then proceed with the banana peel application as normal. The baking soda provides an additional, very mild alkaline abrasive effect, and the coconut oil provides a medium that some people find reduces surface tackiness. But I want to be very clear. Baking soda, when used too frequently or in too large a quantity, can be abrasive to enamel. 1 night in 7 is fine. Every night is not fine. I tell my patients, baking soda is a helper, not a habit. On night 7, repeat the base protocol, just the banana peel, no baking soda. And in the morning, in good lighting, compare your teeth to the mental note or the photo you took on night 1. Before I tell you about one additional bonus tip, I want to speak very plainly to you about safety, because this is the part of my job I take most seriously. If at any point during this protocol you notice increased sensitivity in your teeth, that sharp, sudden discomfort when you eat something cold or sweet, or breathe in cold air, stop the protocol and consult your dentist. Sensitivity can indicate that the enamel surface is being affected, or it can indicate an underlying issue like a crack, early decay, or gum recession that was already present but being aggravated. If your gums bleed when you rub the banana peel, that is not normal and it is not something to push through. Bleeding gums are a clinical sign that needs evaluation. Stop immediately and see a dentist. If you have any crowns, veneers, composite bonding, or other dental restorations on your front teeth, please speak to your dentist before trying this. These materials do not respond to minerals and natural compounds the way natural tooth enamel does, and any abrasive action, even gentle, near the margins of a restoration can potentially cause issues over time. And if you have any existing pain, any known cavities, any tartar or calculus buildup, any swelling, any ulcers, or any lesions in your mouth, please do not start this protocol. Please book an appointment with your dental provider. Pain is your body speaking to you. Listen to it. Now, the bonus tip, and I want to frame this carefully because it's easy to get excited about an extra step and then overuse it. Strawberries contain a naturally occurring compound called malic acid, which is a mild exfoliant for the tooth surface. Some people mash a ripe strawberry into a paste and apply it to their teeth for a minute or two before rinsing thoroughly. The malic acid can help reduce some surface dullness. However, strawberries also contain sugar and acid, and if you use this method too frequently, you are repeatedly exposing your enamel to an acidic environment, which over time can contribute to erosion. So, if you want to include this, do it once during your 7-day window, not every night, and always rinse very thoroughly with plain water afterward. Never brush immediately after. Wait at least 30 minutes. Think of the strawberry step as a once-in-a-while addition, not a daily routine. 1 night out of 7. That's the appropriate frequency. And if your teeth are already sensitive, skip it entirely. Let me bring all of this together now, because I want to make sure that when you close this video, you feel informed, not overwhelmed. What you now have is an understanding of why surface staining happens, how it differs from deeper intrinsic discoloration, and why a ripe banana peel, used gently, consistently, and correctly, may offer a simple, low-cost, low-risk way to support a slightly cleaner and brighter smile over 7 nights. You understand the exact steps. Brush first, apply gently for 2 minutes per arch, leave the residue overnight, brush in the morning. You know why ripeness matters, why gentleness matters, why consistency matters. You know the common mistakes to avoid. You understand what results are realistic. A potential reduction in surface dullness, a cleaner appearance, a slightly fresher look in the mirror. And what results are not realistic, because I would rather you be pleasantly surprised than bitterly disappointed. You know how your diet and daily habits interact with your tooth color, and you have a 7-night plan that is practical enough to actually follow. You have an optional baking soda and coconut oil variation for 1 night. You have a cautious strawberry bonus tip for 1 night. And most importantly, you have a clear understanding of when this routine is appropriate and when it is time, not a sign of failure, but a sign of wisdom, to call your dentist. Your smile matters. Your oral health matters. And you deserve to take care of it with good information, not promises that lead nowhere. I want to close by saying something that I say to my patients regularly. Taking care of your teeth is one of the most underrated forms of self-care that exists. We live in a world that talks constantly about skin care, hair care, fitness routines, supplements, sleep protocols, and all of those things are important. But your teeth are with you for your entire life, and the way you care for them in your 40s, 50s, and 60s has a real impact on your quality of life for decades to come. Chewing comfortably, smiling without self-consciousness, speaking without pain. These things are gifts that come from consistent, thoughtful, affordable daily care. You don't need expensive products. You don't need a fancy gadget. You need information, you need consistency, and you need to know when something is beyond the scope of home care and needs a professional's attention. That's it. That's the whole formula. I hope today gave you something useful. I hope it gave you something you can actually try tonight if you'd like to. And I hope, above all else, that it gave you a clearer, more honest picture of what your teeth need and what they're capable of with just a little extra attention. If you found this video helpful, I would love for you to hit that subscribe button so you never miss a new video from this channel. We cover practical, evidence-informed health topics every week, and I make it my priority to bring you the kind of information that is honest, careful, and actually useful in your real daily life. Leave a comment below. I read them, and I genuinely enjoy hearing from you. Tell me if you're going to try this 7-day protocol. Tell me if you've already tried something like this before and what your experience was. Tell me what health topic you'd like me to cover next, because a lot of our best video ideas come directly from your questions. And if you know someone who would benefit from this, a friend, a family member, someone who has been asking about natural dental care, please share this video with them. It costs nothing, and it might genuinely help them. Thank you for spending this time with me today. I'm Dr. Carter, and I'll see you in the next video. Take care of yourselves.